Hi everyone, my name is Fu Wanyin from INTI International University. This video is prepared as part of the individual assignment for the Information Security and Ethics course. Today, I'm going to share a real-world style case study about Medixis Solutions, a healthcare application service provider that faced a serious cybersecurity breach in 2025. Medixis Solutions is an application service provider, or ASP, based in Singapore. It provides cloud-based electronic health record systems to over 40 private clinics and hospitals across Southeast Asia. Their main platform is called I25032513. It helps clinics and hospitals manage patient records, automate appointments and billing, access patient data from authorized devices in real time, and even issue prescriptions and lab orders digitally. One of their clients is the Silvercare Clinic Group, a regional network of elderly care clinics in Malaysia, which uses Medilink 360 through a monthly per-user subscription to handle elderly patient records. But in February 2025, something went terribly wrong. Hackers exploited a zero-day vulnerability in an outdated firewall plugin. They gained administrative access, stole encrypted patient data, and, because the encryption keys were stored on the same server, they were able to unlock the data. The attack went undetected for 9 days. In that time, 17 clinics were impacted, including Silvercare Clinic. Over 55,000 patient records were exposed, some of which ended up on the dark web along with ransom demands. The purpose of this video is to analyze the Medixis cybersecurity incident. I will discuss the threats, risks, security policies, physical security, encryption practices, and the lessons learned. Through this case, I will examine the company's security weaknesses and discuss lessons. Organizations can learn to strengthen their defenses. This case is a clear reminder of why SaaS security is so critical, not just to protect sensitive data, but also to maintain business continuity and reduce the risks caused by vulnerabilities. A single weak point can affect many clients, harm trust, and disrupt operations. Strong policies, monitoring, proper encryption, and clear responsibilities are essential. Before we look at the Medixis incident, it is important to understand application service provider and software as a service. An ASP delivers software applications over a network, either through the internet or private lines. ASPs usually host industry-specific software and often provide more customized services. The advantage of ASPs is flexibility and personalization. The disadvantage is higher costs, less frequent updates, and limited online availability. SaaS, on the other hand, delivers applications entirely through the cloud. It's cheaper, quick to deploy, standardized, and frequently updated. But it also comes with downsides: less customization, less control for the client, and reliance on the provider to keep data safe. For healthcare providers, SaaS like Medilink 360 is extremely useful. It allows clinics to access patient records anywhere and anytime, without having to maintain their own servers. This improves efficiency and reduces human errors. However, it also means that strong security measures are non-negotiable, because medical data is among the most sensitive information out there. Quality software helps SMEs work more efficiently, stay compliant, save costs, and keep customers happy. It automates tasks, reduces mistakes, and gives real-time insights for better decisions. By streamlining workflows and keeping data accurate, it improves efficiency and ensures consistent service. It also spots problems early, manages resources well, cuts rework, and supports innovation, helping businesses build a good reputation and bring products to market faster. Silvercare Clinic Group uses Medilink 360, with patient data safely stored in the cloud, showing the value of online software. It lets businesses access apps anytime without expensive servers or licenses. Online delivery keeps software updated, reliable, and scalable. For healthcare, it helps manage records securely, reduce errors, improve workflow, and stay compliant. This way, businesses can focus on their main work while the provider handles updates, security, and maintenance. Now, let's look at the main threats that appeared in this case. The first threat is data breaches. In the Medixis incident, attackers stole encrypted data and then accessed it using keys stored on the same server. More than 55,000 patient records were exposed. The second threat is phishing. Employees can easily be tricked into opening fake emails or revealing their login details, giving attackers a way into the system. The third threat is ransomware. If attackers lock clinic files and demand payment, healthcare operations could be brought to a standstill. Investigations into MedicSys revealed several weaknesses. They didn't have a dedicated security operations center or a chief information security officer. Their patch management was weak, with vulnerabilities left unpatched for 5 months. Encryption keys were not stored securely. Real-time monitoring was missing. Unclear SLA responsibilities, incident response times, and breach notifications were not defined. From a client perspective, the breach led to loss of trust, operational disruptions, and potential legal implications. Clinics had to revert to manual record keeping, causing delays and inconvenience to patients. From the provider perspective, MedicSys faced reputational damage, loss of clients, financial penalties, and regulatory investigations. The Malaysian PDPA fined the company 1.5 million ringgit, and several major clinics paused or canceled their subscriptions. This shows why risk management must be continuous. Threats are always evolving, and security can't be left on autopilot. Security policies are rules that explain how a company protects its data, systems, and assets. They give clear guidance to staff, reduce mistakes, and help manage risks. In healthcare, such as at MedicSys, these policies are especially important to keep patient records safe, follow regulations, and maintain public trust. For MedicSys, good policies should have included strict access controls, strong authentication with multi-factor login, regular patching and updates, clear incident response procedures, defined staff roles during a crisis, proper encryption and key management, continuous monitoring with intrusion detection, a dedicated security team, regular employee training on phishing, vendor contracts with clearly defined responsibilities, backup and disaster recovery plans. If these had been in place, the breach might have been prevented, or at least contained before it got out of control. Access controls would have made sure only authorized staff could see patient records. Strong passwords and multi-factor login would have kept accounts safe. Clear incident response steps would have helped staff detect, report, and handle breaches without confusion. Even if systems were attacked, encryption, monitoring, and backups would have kept the data secure. With these policies, trained staff, and solid vendor agreements, MedicSys would have been much better prepared for cyber threats, human errors, and unexpected problems. All these policies follow the CIA security model. Confidentiality means patient data is kept private and secure. Integrity means information remains correct and unchanged. Availability means that systems are always running when staff and patients need them. When we talk about security, it's not just about the digital side. Physical security is just as important for protecting servers and data centers. MedicSys must protect its data centers using strict access control, so only authorized staff can enter. Biometric systems like fingerprint and iris scans add extra verification, while CCTV surveillance and on-site security guards monitor activity around the clock. These measures keep servers and equipment safe from tampering or theft. Protection against disasters is also critical. Backup power, fire suppression, climate control, and even seismic-resistant buildings. And of course, off-site backups are essential in case of catastrophic failure. Locked server racks, intrusion detection alarms, and encrypted off-site backups protect data from theft or loss. To keep clinics like Silvercare running smoothly, MedicSys may use backup power, cooling, and network systems. Regular tests, disaster drills, and strict rules for user access may help ensure everything works reliably and is ready for any emergency. By combining secure data centers, disaster protections, and strong infrastructure, MedicSys may keep patient data safe, accurate, and always available. Now let's talk about encryption. Encryption is the process of turning readable information into a code that can only be unlocked with the right key. There are a few types of encryptions. Data at rest encryption protects data that is stored, while data in transit encryption protects data moving across networks. Symmetric encryption, like AES, uses the same key to lock and unlock data. Asymmetric encryption, like RSA, uses a public key to encrypt and a private key to decrypt. End-to-end encryption makes sure only the sender and receiver can read the data. In the Medixis case, the problem was not the encryption itself, but how the keys were managed. The keys were stored on the same server as the data, so attackers could decrypt everything once they broke in. Best practices include storing keys separately in a secure vault, rotating keys regularly, separating duties so no one person controls both data and keys, and using encryption consistently for both stored data and communications. The main lesson is simple. Encryption only works if key management is done properly. So, what can we learn from this case? The Medixis breach shows that weak security can cause big problems. The company lost clients, revenue and reputation, and even faced heavy fines. Clinics that relied on it had to go back to manual records, which affected patient care. The main lessons are simple. Security policies are important. Risk management must be ongoing. Physical and digital security must work together. And encryption only works if keys are handled properly. Most importantly, patient trust is the most valuable asset in healthcare. By keeping data safe, accurate, and available, providers like Medixis can build trust and serve clients with confidence. In today's digital world, security is not optional. It is a must.